Hi, I'm Wenli, an occupational therapist from NUH. In this video, I will be answering some commonly asked questions on how to care for your hand after the carpal tunnel release surgery. You may feel that your hand and wrist are feeling worse than they used to feel, but the pain should go away after a while. It takes about 3 to 4 months to recover, and up to 1 year before the strength in your hand returns, and the amount of strength may vary. When there's swelling, avoid letting your hand hang down, as this will cause more swelling. To reduce swelling and discomfort, try to elevate your hand above your heart level when walking around or sitting down. Similarly, when you are sleeping, elevate your hand above your heart level by resting it on a couple of pillows. To manage your pain, take the prescribed pain medications as instructed by your doctor. To protect your wound, your doctor will wrap your wrist in a bulky bandage. You will be scheduled for an appointment to see a doctor to remove both the bandage and stitches after 1 to 2 weeks. Our wound care nurses will advise you on how to take care of the wound. Essentially, the bandage needs to be kept clean and dry at all times. You should go and see a doctor immediately if you have these symptoms. Feeling faint and unwell, having chest pain or shortness of breath, feelings of nausea, developing a high fever, have new or different colored discharge from your wound, feeling a lot of pain at the wound even after you have taken the pain medication. Your hand feels cool, looks pale or changes color, have tingling, weakness or numbness sensation, have pain in your leg, which are signs of blood clot in the leg. You may shower if your doctor allows you to do so, but you should cover your bandage with a plastic bag, secure it with tape to prevent it from being soaked and being infected. Remember to also protect your wound from any injury. Actually, we highly encourage you to use your hand for light daily activities like eating, dressing, and combing your hair. Keeping your hand active will help to reduce swelling and prevent stiffness. So this will depend on the nature of your work. If you are doing desk-bound computer work, you can most likely return to work in 1 to 2 weeks' time. However, if your work requires you to come into contact with water, contaminants, or do heavy lifting, you may likely need to take at least 3 to 4 weeks off work. To help you regain your hand function, we encourage you to use your operated hand for light daily activities. I will also be showing you some exercises that you can do to help with the recovery. Nerve and tendon gliding exercises are important in reducing the formation of adhesions between the structures in the carpal tunnel. Firstly, I will go through some tendon gliding exercises. Each exercise should be done slowly for 5 repetitions before moving on to the next exercise. To start, keep your elbow supported on a stable surface. Make a hook fist with your fingers, keeping your knuckle joints straight. Straighten your fingers and repeat 5 times. Secondly, make a straight fist by bending your knuckle joints and your fingers' middle joints while keeping the last joint straight. Straighten your fingers and repeat 5 times. Thirdly, make a full fist. Straighten and repeat 5 times. You do not need to grip your fingers tightly. Next, do some wrist movements. With your elbow supported on the table, make a loose fist with your fingers. Bend your wrist forward and backwards slowly. The next wrist movement will be to move it sideways. Put your palm face down on the table. Move your hand gently to the left, then to the right. Repeat each wrist movement 10 times. With elbow supported on the table, bring your thumb to touch the tip of your index finger, middle finger, ring finger, and little finger. Then slide down to the base of your little finger. Hold it in this position for 5 seconds. Then straighten out your thumb. Repeat this thumb movement 10 times. Lastly, I will go through the median nerve gliding exercise. This exercise should be done slowly, as if you're doing Tai Chi. Start in a relaxed position with hands by your side. You can either stand or sit up straight. Tilt your head to the opposite side, away from the operated hand. Bring your head up, and then bring your arm up towards your chest, with wrist bending backwards and fingers pointing to the floor. Tilt your head to look at your wrist. Next, tilt your head back towards the center. Bring your arm down to your side and relax the wrist. Repeat the cycle 5 times. Each cycle should take about 10 seconds to complete. We recommend doing the whole set of exercises 3 times a day. For patients whose surgeon have chosen to use the non-absorbable stitches, you will be given an outpatient clinic appointment to remove your stitches, usually 2 weeks after surgery. Here's a tip to remember. Do not swim for at least 2 weeks after the surgery. If you wish to use the hot tub, please do not soak your affected hand in the water. Yes, it's normal for your scar to feel stiff and sensitive after the surgery. After a surgery, the wound heals naturally by forming scars, which will feel hard, sensitive, and sometimes painful. Scar tissue can become a problem if it limits motion and function or is painful with touch. Hence, it is important to massage the scar to help improve flexibility and reduce pain. Scar massage should start 1 to 2 days after your stitches are removed. So here's how you do it. Sit down comfortably and place your arm on the table with your palm facing up. Dab a little moisturizer on your scar. Use the pad of your finger or thumb to press firmly into the scar tissue and massage it in a small circular motion along the scar. Do this for about 5 minutes, 3 times a day. It is normal to have some pain when you start scar massage initially. You should massage gently at the start and gradually apply more pressure as the pain reduces. So during the first 2 weeks after the surgery, protect your wound from coming into contact with water or contaminants. You now have an excuse to get a family member to help wash the dishes. But if you have to wash dishes, make sure to wear gloves. Avoid activities that require forceful and tight gripping, such as wringing towels, carrying heavy items with your hands, and the use of power tools. About 4 weeks after the surgery, you may move on to heavier tasks, such as vacuuming and gardening. With carpal tunnel syndrome, the finger numbness is a result of injury to the nerve due to prolonged compression. While the surgery will help to reduce the compression on your nerve and prevent further injury to it, the nerve is already injured and will take a few weeks to a few months for it to heal, depending on the severity and duration of your carpal tunnel syndrome. Do speak to your doctor or therapist on the expected outcomes of the surgery. We hope this video has been useful to you. To find out more about carpal tunnel release surgery and the post-surgery care, do talk to your healthcare provider or visit the NUH website or video in the link below. Thank you and bye!